Excellent. Brilliant. So I think we've got everyone here, and I think we're up to people starting. So we are just going to get started because we have a tight schedule today. Welcome, everyone. Thank you so much for coming to our guest speakers today and to our audience who are joining us from across the globe. Thank you so much to you for taking the time to join us at one of our welcome webinars. So we run our welcome webinars for organisations or individuals who have already just recently joined Nursing Now Challenge, or we organise them for people who are considering joining. And then, yes, anyone else who wants to just drop in, more than welcome. So we could have all of those individuals here today or organisations. We have a bit of a packed webinar today. We have got an update from me really on what we're doing now in Nursing Now Challenge. Much of it is our usual stuff, but there is a lot more new things there, so that'll be great for you to hear. And then we've got the most important bit, really hearing from our Challengers Committee and our experiences of individuals who are involved with Nursing Now Challenge. And then we also have a guest from the Centre for Sustainable Healthcare, which offers free courses for nurses and midwives at all different levels, talking to us about sustainability, actually. And then we'll have 10 minutes at the end for Q&A, so please put that in the chat, and hopefully we will have time for a little bit of summing up, but we are going to crack straight on with it. So next slide, please. For those of you who are hi there, yes, please in the chat put where you're from. We've got Benjamin from New York in USA. For those of you who are less familiar with Nursing Now Challenge, we are a global network of student and early career nurses and midwives. We are across the globe, as you can see, in 156 countries now, which is quite substantial. I'm sure you would agree. We are almost tipping into the 250,000 mark, which actually is amazing if we think back to, I know Amy did this great video when we were thinking about the thousands. We had achieved our 100,000. And here we are now just tipping into almost the 250,000 members in our network from across 1,275 organisations. Next slide, please. Thank you. And reminder, this is the thing that comes as a surprise to most people. We are totally free. It's great. You can join. You do not have to sign your life away. You don't have to pay anything. You can register to be a member, and you can do that as an individual and as an organisation or both. We have, oh, hi, Benedicta from Nigeria. We have organisations who have individuals who are members also. So please feel free to do both of those. If you're an organisation joining us today, please know that, and encourage your early career nurses, students, etc. to join individually. That means they will get all the messaging, etc. from us to themselves individually. We work across the piece in healthcare, health employers, universities, colleges, and really our purpose is to enable and educate, transform, offer opportunities for leadership development for students in early career nurses and midwives. Sorry, gosh, there's lots of people joining. It keeps popping up on my screen. What do we offer? We offer a range of things, and we try to encapsulate that into these 4 areas. However, that's quite challenging because we do offer so much, of which you will hear a bit in a wee while. So we offer resources, information, sharing, strengthening your global network. That networking we offer is great. You can hook up with people within your region or out with your region and collaborate with them online and in person. And leadership is really a key area for us. There are many multitude of personal and professional opportunities for you, both locally and globally, and we'll showcase some of those. Really, there is something there for everyone, and if you want to engage, then really the world is your oyster. And the final component is research and innovation. The innovation we have is quite well established with our Global Solutions Initiative. The research is a real emerging area for us and one that we wish to continue to grow. Next slide, please. Um, who are we? Who is at the helm here? We have a wonderful advisory board on the Nursing Now Challenge. Sadly, you can't see some of their faces here. Formidable team who have been with us really from the early days of Nursing Now, but they come from across the globe. And they are the advisory board. We meet with them 2 to 3 times a year, maybe even 3 to 4 times a year. So they provide us with a great steer. They are interested in what's happening in their own region. Here they are, they're popping up now. Nurses, non-nurses, and you see Amy and Sana, they're also representing the early career nurses from all over the world. They're a wonderful group of leaders to support us. Next slide, please. And with them, they have all nominated Nursing Now Challenge Associates within their region, although we're still looking at membership from regions that are not represented, but these are the ones at the moment. Again, this is about us hoping to reach more people who are within our membership, so we have a little bit more capacity at a senior leader level within the organisation. So the wonderful Rhoda Radilla, who is based in New York, she is going to be running a writing workshop in terms of publication for us shortly. So those are the type of things that our associates support us with. Next slide, please. All these are resources for you. This is wonderful. This is oh, fantastic. Lorena from Colombia in South America. This is our offering really presented so beautifully. Health action training, which is leadership development at all levels, right up to postgraduate certificate accredited, Global Solutions Initiative, our Global Book Club, the mailings that we send out with opportunities and updates, wellness webinars, Challengers Committee, we'll say a little bit more about that. Opportunities to publish in Nursing Times, the debate series, which is something that we are developing at the moment. You'll hear more of those later. Voices in Nurse Education, the final of the education webinar series from the Western Pacific, is actually a very good colleague of mine is presenting this, Professor Tonks Fawcett. And Grassroots, which you've maybe seen on social media. Something is watch this space because it's coming and it is absolutely fantastic. Next slide, please. So the Grassroots podcast, this is a new Nursing Now Challenge series that will celebrate early career nurses and midwives, those who are on the ground day to day with their patients as innovators and agents of change in healthcare. These will be hosted by our regional hub leads. Each episode features inspiring stories from members across the world. We are currently recording these episodes now. The first one was done last week, and following sessions are already booked coming up. So we plan to launch this new series in November. And this really is, I mean, for me, this is one of the, I say most exciting things this year, but actually there have been many. But we were really keen in the team that we wanted to hear from nurses at the bedside or in communities or in the different settings, or midwives who are providing that direct care to communities, individuals in whatever space they are in. So you'll see who we have. Lucy has just done hers. That's Australia. Indonesia, Viola will be next, and then Derek in Uganda. If you're interested, please let us know, but please watch these, and we will be sending out more details about where you can listen to these podcasts of Grassroots. So another way of us engaging with our wider global nursing community. Next slide, please. And I mentioned their Nursing Times publication. We have a collaboration with Nursing Times, which is a nursing journal in the United Kingdom, but it's a global journal, and it is very much for practicing nurses. And we have so far, or specifically, our regional members, our hub leads and members, have been writing furiously, and we have had 20 articles published, or they have. 13 countries have been covered, and we know from the editor that those articles are certainly getting some of the highest hit and time spent and most read. So I think that says a lot about what early career nurses want to read, or what practicing nurses out there, they want to read something that relates to them, that is about what is going on in practice from across the world. And the topics are varied, so and they are fantastic. We would just want to say a big thank you to everyone who's taken the time to write and will continue to write, because this is what we want. I remember being told, if you want to be the authority, be the author. So that's what we're doing. We're encouraging nurses to be the authors and write our story. Next slide, please. And Global Solutions Initiative, the most recent winners are two amazing early career nurses, one from Nigeria, one from Australia. And this was around working with FONS around clinical supervision. And those of you who don't know what this is, it's an opportunity to engage and create solutions to challenges that we have or that are relevant to our clinical practice. And this one was around clinical supervision. The Foundation of Nursing Studies provided, over a 4-week period, 3 in-depth sessions on clinical supervision around its purpose, what it looks like when it's done very well, and how to engage teams. And the 2 winners, who then took up the actual challenge to come up with a solution, then got the most amazing prize. So they are to join the Resilience-Based Clinical Supervision Champion and Cascade Programme. They are allowed to bring 2 colleagues each to support implementation at their local setting, and they become part of the global RBCS network to strengthen practice and peer support. So that would have usually required funding, but this was the winner's prize. And because they were both such good applications, we couldn't decide, so they were both winners. So thanks to FONS for all the support and being able to work with us to deliver such a great Global Solutions Initiative. Next slide, please. Health Action Training, I've mentioned that already. It delivers some wonderful courses in communication. Sometimes this video works, sometimes it doesn't. But we'll see. Often takes a little bit of time to load. But this programme has been hugely successful, and we're very well evaluated with those who have undertaken it, where practical applied drama, actor training, through evidence-based research is used to teach and improve person-centred care. Oh, there, Lingan has just said, excellent courses, hat. And then our global book club. The next one coming up is palliative care, children's palliative care, with Professor Julia Downing, who does some amazing work overseas, particularly in Africa and other areas. So she will be doing that on the 10th of October, 2 p.m. Please share this. This is an opportunity we have for our members to engage with authors around their books, the topic area, stimulate ideas. And what we're really trying to do there is get early career nurses into conversations with authors about topics that are relevant to us in nursing, and that critical thinking, stimulating discussion, taking away ideas. And also we really want to promote organisation hosting their own book clubs for their early career nurses. And this is one way of doing it, showcasing it here. Next slide, please. And a little insight into the Challengers Committee. Next slide. So if you join as an individual, you will be offered the option of joining into the Challengers Committee, which I always describe as the engine house of the Nursing Now Challenge. And you will be connected to your regional hub where you work. However, we do have, for example, in Sana's case, she is working here in the UK, so is Eurohub, but she is from Pakistan, so she also supports Eastern Med regional hub. And being in the regional hubs is a fantastic opportunity, but being in the Challengers Committee offers so much more. And I'm sure Amy will update us on some of those things that have been going on later. But this is our current regional hub leads. We're almost at full capacity, but we would love to have more of you join us in there. I think we've got over 4,000 individual members. And then here they are. They are wonderful. So we have Africa represented, Americas, and Eastern Mediterranean. And I'm actually thinking they're all women on that slide, bar one. And then the European region, Southeast Asia, and Western Pacific. So we're actively trying to fill those other spaces. So please, if you're interested, come and join. You will be able to take up so many other widening opportunities by contributing. And it is such a group of the most inspiring individuals I've ever met in nursing. They are exceptional. Next slide, please. We invite you to join the Challengers Committee. Big push here. If you're interested in playing an active role, then please contact challenge@nursingnow.global. You will not regret it. It is absolutely wonderful. Next slide, please. And here we are about to hear from our Challengers Committee. And that is Sana and Amy. I think Amy is definitely with us, not sure about Sana, but over to you, Amy.
Thank you so much, Aisha. Good morning, everyone. My name is Amy Staley, and I'm proud to join you all today as a nurse from New York City and also as co-chair of the Nursing Now Challengers Committee. I currently work as a patient care director of a neurosurgical ICU here at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City. And I am immensely proud to serve in my co-chair role alongside Sana. So, as nurses, I would imagine that many of you ended up in your positions similar to the way that I ended up in mine, which is because of another nurse. I joined the Nursing Now Challenge in 2021 when a mentor of mine, Miss Rhoda Radulia, invited me to a Nursing Now virtual global footprints event. So, following this event, I was invited to join the Challengers Committee and even won a Nursing Now Challenge Global Solutions Initiative, where I received funding to benefit vaccine equity and adherence for two nonprofits here in New York City. One was a harm reduction center, and then the other was a foster home where I had worked prior to my nursing career. So since this day in 2021, I've had the opportunity to have a global impact with over 218,000 nurses around the globe, and to continue this global impact by advocating for nurses at the bedside, in my community, and at the United Nations General Assembly each year. To say that these global solutions initiatives will change your life is honestly an understatement. In about 3 weeks here in New York, I will attend the United Nations General Assembly for my fourth consecutive year. Last year, I brought 3 nurses with me, and this year I have an ongoing list of 20 nurses that I plan to bring with me to these events. And years ago, policymakers and politicians and CEOs would have thought that it's so unusual to see nurses in a space like this. But because of organizations like the Nursing Now Challenge providing these opportunities to nurses like me, it's normal. Like, yes, of course, the nurses are there advocating with the CEOs and politicians. And since 2021, we have grown from a network from around 30,000 to over 249,000 that Aisha shared today. The number is really insane. We've amplified the voices of nurses all around the globe. We've shifted the opinions of politicians and policymakers, presidents within 24 different time zones, and single-handedly changed the way the world views our profession. There is only one word to describe this group, and that is powerful. I could sit here and I could describe the definition of power to you today, but it's actually here within this room with us today. So you'll see from Shazia and Hassan, many of our other members are here today as well, that will show you that the power lies within our unity and drive to forge the future of our profession, and within our powerful leaders like Aisha, who have unleashed this power from within for each of us. And most importantly, our Challengers Committee hub leads and members who continue to have the courage and the audacity to hold open the door for the next nurse, or should I say the next group of nurses who are hopefully here in this room with us today. So the Challengers Committee is made up of 6 regional hubs, like Aisha described. Within these hubs are these individuals who are provided with access to a unique network and the ability to connect the best nurses and nurse leaders around the globe. So each regional hub has regional hub leads who work to facilitate the growth, development, and expansion of the region. These nurses know that when you advocate for one nurse, you're advocating for all nurses. So in our Americas region, for example, we have nurses like Stephanie and Tracy who are representing the profession on a global scale, growing the profession through research and innovation. Abigail, another one of our regional hub leads, who was privileged to attend the State of the World's Nursing Report launch in May, this past May. In Africa, we have nurses like Zipporah and Dr. Maureen Musey, who have taken their advocacy from their communities in Africa into the ears of policymakers, demanding safe conditions for our nurses and patients. Maureen just got back from Russia, where she was advocating for our profession, which was absolutely amazing. We have nurses like Andreas and Lincoln, I saw is here in the chat with us today in our European region, who truly bridge the gap between artificial intelligence, immeasurable growth, and humanity for our patients all over the globe. In the Western Pacific region, our team is exploring potential engagement between some different organizations. Sung Po Aaron, one of our regional hub leads over there, recently connected with some Australian early career nurses to grow our program. He's also hosting an amazing masterclass on September 4th for those who might be interested. It's the final webinar of a series he's been hosting throughout the summer. And if you're interested in connecting with him on LinkedIn, I will post his name in the chat there so that you can sign up for his masterclass. In our Southeast Asia hub, we're working to defeat the mental health crisis and improve nursing research. And then in our EMRO region, you're going to hear from one of those leads today. They were recently featured in a Pakistan nursing radio show. One of them also published a chapter in an international book. So many things going on within our regions. And in addition to this network, as a member of the Nursing Now Challengers Committee, you'd have access to the Nursing Now board that consists of these incredible nurse leaders you saw earlier in the slides. You'll have a first look at initiatives, challenges, and these incredible networking opportunities. We've had the pandemic accord that we've had a say in. We've had the State of the World Nursing Report, health action trainings, our global book club, so many incredible networking opportunities to connect with different people all over the world. There's really only one profession that's powerful enough to deliver 90% of the world's healthcare, and we know firsthand that that is nursing. And there's only one group powerful enough to change the narrative of the care that we provide around the globe, and that is this group right here. Our power is not only measured through our success and who we are and our accomplishments, but rather what we choose to do with that power. And with that, I'll pass it along to our next speakers here today who are going to show you exactly what they've done through the power of the Nursing Now Challenge Network. Thanks.
Thank you, Amy. And I know Sana has just joined. So Sana, hi. I know we can't see because the screen is in bits. So Sana, was there anything else you wanted to add? Amy, thank you so much for, I mean, when you say all of those things, it is just amazing. And the number at 249,000 is outrageous. Sana, do you want to say anything to everybody in the welcome webinar? Anything else?
Thank you, Professor Aisha. Thank you, everyone, for joining today. And it's so amazing to see a lot of familiar names and a lot of new people in there. And thank you, Anna and the team, for making this welcome webinar happening. I think Amy said it all. There is nothing actually I can say more because she covered everything. And I think that's the power. From my own experience, I would say if it was not Nursing Now Challenge, I wouldn't be a nurse, and now I wouldn't be a midwife. My whole career, where I am today is because of this challenge, because of this platform, and because of the people I met throughout the journey. And this is something every nursing and midwifery students, every early career nurse and midwife would need at one point in their life. When I got the opportunities to speak in some of the platforms, and I would know some journalists who were nurses by background, they would come to me and they said, Sana, if we knew you when we were nursing, we would be still in the bedside and we wouldn't left nursing. So that was something I would heard a lot from previous nurses who are not in practice anymore. And they said they had the same challenges, but they did not had Nursing Now Challenge. So this is what it is. And not more long ago, I met with one of the chief nurses and she said, I had to wait 15 years to get my first ward manager post. And I said, you don't have to wait that long if you're ready. You can be an early career leader. So that's where we are changing that narrative, that tradition, that if you're ready, if you're passionate about, you get the experience you need, and then you should be there to make that change. And it's not about being a manager, it's about being a leader, being an advocate at the bedside for your patients, for your new generation, for the students who are coming to you and see you as inspiration, speaking for them. I think this platform gives you all of it: the advocacy skills, the spotlight, it gives you research opportunities, networking, meeting with people from very, very top to very bottom. So if you know student nurses and midwives, early career nurses and midwives, if your organization is very keen to build on the capacity of leadership development of early career professionals at your organizations, get in touch with us. Thank you.
Excellent. I mean, outstanding, both of you. So super. And I always say this, there's more of them, there's so many more. So the great thing now is we've told you how wonderful it is. So now we're going to hear from colleagues, members and new members, and we're definitely crossing the world. We're doing Mediterranean region, Africa region, and we've got Euro region with Scotland, which from my accent, hopefully you'll know that's the Sudan bit is there, but the Scottish bit is also there. And I'm delighted to welcome Marissa Parker, who is at NHS Forth Valley in Scotland here. In fact, this is my local board. And Marissa has come to just share a few, I guess, her experiences of being part of Nursing Now Challenges, quite a new organisation. Over to you, Marissa.
Hi, thank you for having me along today. As Professor Aisha kindly said, I am from Scotland. I work in Forth Valley. For anyone who doesn't know, and you probably don't, it is one of the 14 territorial boards in Scotland. It's one of the smaller boards. It sits centrally in Scotland, sandwiched nicely between Stirling and Falkirk, Clackmannanshire. It's a lovely place in Scotland, I have to say. It's one of the most beautiful areas. So if you are looking to come to Scotland, I would definitely put Stirling area on the map. We joined about a year ago. We had this chat with Hannah and Aisha. Couldn't believe it was free, but it is. She had to tell me about 10 times to convince me. It's absolutely fantastic that we have this resource. I have joined as an organisation. Forth Valley have around about 3,500 nurses and midwives within our remit, for which I am head of practice development and education for. However, what I'm also trying to do is get people to join individually, because although as an organisation we're putting it out, sometimes you find that there's that middle tier of the information dripping down, and if they join themselves, or you join yourself, or you're joining as an organisation, encourage others to join individually, they will get that information as quickly as we get it as an organisation. So really just trying to encourage and empower people to join individually as well as an organisation, and just really spread that leadership is at all levels. And that absolutely, as San had said, that it's so important to show those leadership skills. Be the nurse that you want people to be that next generation, bringing them on. Who are the next? Professor Aisha's coming through. How do we spot them, talent manage them early, and get them into the right roles that make an impact at a really, really high level in our society, and get that nursing voice across. And we're trying to do that locally in terms of our area nursing midwifery committee, where we have early careers nurses and students joining, and that voice goes right up to the executive nurse director and the CNO as well, so that we have early careers nurses in Stirling, Falkirk area having their voice within an organisation. So it's been absolutely fantastic. We are still at the phase of rolling it out, getting the voice out there within Forth Valley, and also what I'm trying to do as well is encourage my Scottish colleagues to join also. So it's been lovely to come here today. I'm really invested in the leadership and development. I am a passionate nurse. I have been for 21 years, although I know you're shocked. It seems like I'm just qualified, but yet 21 years. And I just want to see people do well and encourage them. So if anybody wants to reach out, happy to have that conversation through Aisha and Hannah and the team. And thank you for having me.
Oh, thank you so much. That's wonderful. Yes, applause. That's great, Marissa. Thank you so much. What is wonderful is that you're coming on to just share with us how you, as a leader within your organization, are supporting your nurses and midwives and trying to bring this in as a resource for you, that along with all the other wonderful things you're doing there. And what is great is that we need people like you to facilitate and be that supporter, be that mentor, be that ambassador. And your whole organization's culture will grow based on the visibility of your actions and us trying to work together to give them a better experience and give them opportunities. And I'm really pleased because we've been really trying in Scotland. We've grown quite a bit in the rest of the UK, but Scotland, you're kind of leading the way, the trailblazer. So we really appreciate what you're doing, and thank you so much today from all of us here at Nursing Now Challenge for that continued support and sticking with it. We're very grateful. We need more Marissas. Now I'm handing over to, well, I don't know, maybe I can just choose. Let's go with Hassan. Are you ready?
Thank you, Aisha. Thank you, Aisha and Hannah, and all the fellow panelists, members of the Nursing Now Challenge committees, the esteemed colleagues in this webinar today. I just want to say welcome and thank you for being here today. It's such an honor for myself to share how transformative Nursing Now Challenge journey has been for me. I'm a community health nurse by training and education, members of the Afro Challengers Committee, and I co-lead the Humanitarian Policy and Advocacy portfolio for Doctors of the World across the UK. I first encountered Nursing Now back in 2018, before it was even on this amazing current format. At that time, I was a young nursing student. I was a researcher. I just won a prize at an international conference. I met Dr. Jen Salvage, who is a lovely and amazing global health leader. She introduced me to Aisha, saying that she was building a community of global leaders of early career nursing that I would love to be part of. From that moment, I stayed in touch remotely with the Nursing Now Challenge as it took shape and evolved. In 2021, I won the Nursing Now Immunization Championship prize with 8 other colleagues from across the world. I got trained as an immunization advocacy champion, very deep and personal practical training on storytelling, building momentum for advocacy. One particular moment that stood out for me when I used the same storytelling techniques as part of my job application for an international organization, and I got that job, which was my very first international post. Since then, Nursing Now has been a steady part of my professional journey, supporting me as a community nurse who work in a humanitarian context. In 2024, while I was pursuing my master's in humanitarian studies, I became a member of the Afro Region Challenge Committee, and I had the privilege of joining the Global Book Club. The panel was exploring the economics of arrival, a book that resonated strongly with my studies. That experience have given me a confidence to speak about the health economics, leadership, and socio-political changes needed for better health. And as always, Nursing Now was there, amplifying my voices, sharpening my skills, and giving me the platform to advocate for change, not only in hospitals, not only on 1 or 2 countries, but globally. For example, last summer, I was part of the launch of the State of the World Nursing Report. I had the honor of moderating a session at the Royal College of Nursing and attending the launch report at the House of Lords, where I spoke to leaders from across the world who are not only shaping the global health policy, but also have a strong commitment to early career nurses. Today, I'm part of the England Chief Nursing Officer Strategy Working Group, helping shaping the UK 2040 nursing workforce strategy and addressing and combating global challenges. I confidently can say without a hesitation that these opportunities were made possible because of the Nursing Now Challenge. Being part of the Nursing Now is a career push, a skill boost, and perhaps most importantly, it's a community. And it's a space where you can meet like-minded people and intergenerational leaders who truly believe in the power of nursing leadership. It's a place where everyone can flourish and authentically lead and keep learning every single day. The growth is subtle but steady, and it lasts for a very long term. So I encourage you to be part of this fascinating community and to join the Nursing Now Challenge, as it will be very, very transformative for you as well. Thank you.
Wonderful. Thank you so much. Absolutely fantastic. You know, the thing I love is that you all just come on here and you just deliver, and it is just fascinating. No, you know, it's all organic, it's authentic. It is just wonderful. Next up, so thank you, Hassan, for that great I guess, expression of your experiences, and yeah, just beautifully delivered and so eloquently too. And so finally we are off to Shazia. Hello, Shazia.
Thank you so much, Professor Aisha.
Hi.
Hi, everyone. This is Shazia, and I'm originally from Pakistan, an early career nurse. I'm currently based in Kuwait and working as a registered nurse. So, first of all, I would say huge thank you for the Nursing Now Challenge for giving me this golden opportunity to share my experience with this remarkable organization so far. So I joined Nursing Now Challenge last year as a member, and I was initially introduced to the Health Action Training Program, which you guys might have heard before as well. So it's a 3 month training course, and I got to learn about patient-centered care through a theater-based teaching and learning approach. So I would say that the health section training was the perfect starter for me and an invigorating experience to be with this organization. And it wasn't just that. The Nursing Now Challenge actually introduced me to more learning opportunities, be it global solution initiatives that pushes us to think beyond the limits, or wellness webinars or global book clubs, which are my all-time favorites. And it gives us an opportunity to interact with the author and have some more insights. So these activities, I believe, ensures the members' engagement within the organization and networking, and their continuous professional and personal growth, as I felt from my side. So while serving as a lead for the Eastern Mediterranean region for the past few months, the Eastern Mediterranean region that comprises of about 22,264 members, 77 organizations in 19 countries. I believe that the region is full of capable and potential nurses who have the ability to lead and make a difference. And it's not just about, I think, one region. We have a powerhouse of brilliant nurses from different regions who are here sharing a common vision. And it's the Nursing Now Challenge that is connecting us all together in the most exceptional manner possible to work in different capacities, be it patient care, be it environmental sustainability, nursing research, nursing education, community health, and much more. So this year recent event, which was the Nurses Day celebration, and especially the role of Nursing Now Challenge in advocating for the State of World Nursing report, it was a mind-blowing experience for me, being a early career nurse, I would say, and an eye opener for all of us indeed, where we unitedly realized the power and impact of the Nursing Now Challenge. So there were 6 regions, thousands of members enthusiastically and collaboratively brought forward a highly impactful global nursing movement, which with a humble reminder that we all are connected no matter where we are and ready to drive a change that is much needed. So it was even more uplifting to see being a lead that all the exceptional members of different regions and leading different activities and advocating for the State of World Nursing report in their own regions. And I believe that this snowball effect gave me the confidence to introduce Nursing Now Challenge and the advocate for the State of World Nursing report in Kuwait for the first time. So from getting inspired by our very own great leader and mentor, Professor Aisha, whose vision in contribution to uplift the nursing profession is exemplary. And it would be unjust to not mention Sana Baloch, who was my senior back in the nursing school. And since then, she has been an inspiration for me and for other nurses like me who are passionate to step into the world of nursing leadership. And all my amazing colleagues and friends at the Nursing Now Challenge Committee, the members, the core members, the leads, who were always there to push me to think beyond the limit, to keep myself engaged, and to share my inner voice. So this roller coaster of experiences has been nothing short of a blessing, I would say. And I just want to conclude by sharing my all-time favorite quote by Kofi Annan that says, "You are never too young to lead, and you should never doubt your capacity to triumph where others have not." Thank you so much.
Oh, how fantastic. I mean, honestly, this is just, I say it every time, it's like a masterclass. I mean, it is just so wonderful, and to see you all flourish and really grow and have that confidence, and it is just absolutely joyful. It is absolutely joyful, and we are so grateful and inspired by you all. Thank you so much. You are the network. This is it. You are Nursing Now Challenge, and everyone who's new to this call today, I hope this demonstrates exactly what is happening here. Real empowerment, real change, not just talking it, but actually living it, breathing it, doing it. And that's what they are doing. And this is the best thing. I'm sorry, but I'm going to say it's the best thing that's happening to nursing at the minute. There you go. I'm saying it. Okay, so next up we have a guest and another guest who's about to come on, and that is Anna Brady. We have recently started to engage with Anna and the Centre for Sustainable Healthcare, and Anna is just going to tell you a little bit more about what that does. Sustainability. In fact, I'm heading back to Edinburgh to chair a session on sustainability in nursing for the Royal College of Nursing. So it's high on the agenda. Anna, welcome, and over to you. Thank you. And then we'll have time for some questions at the end for everyone.
Thank you very much, Aisha. And I'm looking forward to seeing you at the event. I'll be there to watch your presentation.
Well, are you in person there?
Yes, I'm in person.
Oh, that's wonderful. I'll see you there. Yes. Great.
I hope you can see my slides. Yes, okay, perfect. Well, thank you very much for inviting me here. I'm just super shortly going to present my project, which is the future of health and social care, quite big. And I'm trying to educate nurses and midwives on green nursing and midwifery and how we as nurses can impact social and healthcare by making it more sustainable. This is my project. If you want to scan the QR code, you can here, but we're also going to put the links in the chat afterwards. So I'm going to start with I'll try to say it in a minute, of why do we actually need sustainable healthcare. So the current systems that we have are unsustainable, and they lead to health impacts that are not only causing climate change and environmental degradation and pollution, but also they directly impact the health of the people that we treat, the people that we care for. Part of that is our health systems. They're wasteful, they create emissions and pollution, and they're mainly focused on treating disease at the moment. And they're not focused mainly on helping everyone lead a healthy lifestyle in the first place. Here in the UK, the NHS accounts for 40% of all public sector emissions and is responsible for about 4% of all the vehicle journeys on the road and 2% of all the plastic pollution. These planetary emergencies contribute to worsening health and social inequalities, and they create injustice on all levels, from local to international. On top of that, a rise in chronic diseases, which is also connected with this unsustainable system and unsustainable lifestyle, and an aging population, along with understaffing and stretched resources, contribute to an unsustainable system. And this means we need to rethink how we as nurses provide care. So what we've done is we created courses that will give you an overview of how these planetary emergencies of climate change, biodiversity loss, and pollution impact the health of your patients, and how healthcare contributes to these issues and is at the same time also vulnerable to these effects. The biggest part of having a course on it is, though, not just to give you the problems, but obviously give you the solutions or help you to find your own solutions. And for that, I think it's important to know what sustainability means. And sustainability was defined by the United Nations as meeting the needs of the present without compromising the ability of future generations to meet their own needs. And we have defined sustainability as in sustainable healthcare then as delivering care in a way that maximizes the positive health outcomes through the best use of environmental, social, and financial resources, which means that the future generations still have the resources to meet their own health needs. We'll be training you in calculating the sustainable value of the care that you do provide. And it's important to note as well that sustainability is not outside of nursing care or something entirely new or separate that is added on to your already stressful work, but it is a domain of quality of care alongside all the others. These are the 3 courses that we offer. There are 3 courses for 3 different levels in your career. The first one is for frontline nurses, midwives, also student nurses. So if you want to join that one, that's right for you. It's sustainable innovation for nurses and midwives, and it will teach you the foundations of sustainable healthcare and the foundations of sustainability and quality improvement. It's about 8 hours of learning materials online and then a 2 hours webinar. The second course, Sustainability Analysis and QI in Nursing and Midwifery, is for specialist service or team leads. So if you have a responsibility for a team, this one is right for you. And it, apart from teaching those foundations of sustainable healthcare, as in the first course as well, it also gives you a deep dive in sustainability and quality improvement and carbon footprinting. This means the course is a little bit longer. It's the foundational course plus 2 hours of SUS-QI and carbon footprinting and a 4-hour webinar. And both these 2 courses help you design and implement your own sustainable quality improvement project in your practice. And then there's a third course, which is a little bit more high level. But seeing as Marissa is here, I think it's still useful to talk about it. There's a sustainable innovation leadership for senior nurses and midwives, for board or near board level senior nurses and midwives, where we are teaching how to lead the sustainable transformation and how to systemically include sustainable innovation into your organization. This also gives you access to the foundational materials, and also there is a 2-hour discussion-based webinar with some really amazing support from Claire Cable and also Lucy Brown and Rodney Morton. If you want to participate, for you to know, courses are available for any registered nurse or midwife wherever in the world you are. You can join at no cost thanks to the Burdett Trust. And you can book the places online, or you can enroll online. And if you do have questions or you don't quite know which one you would fit in, we do have a lunchtime Q&A on the 9th of September, and I very much invite you to join us there. Thank you very much.
Wonderful, wonderful, Anna. And this is so interesting. And for those of you who've joined the call, the Burdett Trust for Nursing, obviously Nursing Now Challenge is a programme of the Burdett Trust for Nursing, which is why we are, working more closely with Anna and colleagues there. The great thing about this, there's courses and resources for every level, and they are available, as Anna has said, and this is a very important area for nursing. So if there are any questions, we've got 10 minutes really maybe to just go through anything that's cropped up today, any questions that you have for us, and just pop them in the chat. We've had a real good activity on the chat with people commenting. Sana signed up for the workshop. I'm going to be doing that course. When I'll get round to it, I don't know, but I will be doing it because I should have actually done it ahead of this evening. That might have been useful. And I know that Marion has been on with some items of news around her Art of Nursing webinar series, or webinars featuring nurses and artists who make a difference, and the link is in there. So yeah, if anyone has got anything else they'd like to ask of any of our speakers today, please do. Any burning issues, or just tell us a bit more about where you're from. And if you can pop that in a chat, we will put it to the speakers. I'll just wait a few more minutes and see if there's anything coming in. Oh, Amy, yes, Amy has gone, but Holly, we'll take your details if you pop them in the chat, your email, and we can pass it on to Amy about going to the UN General Assembly week. That would be great. Be great if you could catch up with her there. While we're waiting on some more questions coming in, just some update that's happening in England. We have several of our regional hub leads and members who are actually co-chairing the CNO working groups for the CNO strategy for England, and that's been a significant outcome of the work that we are doing to enable and provide opportunities to those early care nurses and midwives that we have within Nursing Now Challenge. And the fantastic thing really about that is that this isn't about just having a seat at the table. This is being invited and then co-chairing. It's a fantastic opportunity. So I can see we have Taha Rehan. Are there any opportunities for nursing students early on in their degree? Yes, absolutely. So Taha, if you email us, or if you can register online, we have nursing students early on in their degree who have worked their way through over the years with us, and there's maybe someone else there, maybe Lincoln or Sana. We haven't got Andreas with us, who probably had followed that path, who might be able to let you know. But all the opportunities that are on offer are for everyone. We don't have this is only for nursing students, this is for registered nurses. The opportunities are for everyone. And as a nursing student, universities are almost about 50% of our organisations who've joined, so you can sign up and you can join individually and join into the Challengers Committee. If you let us know which country you're in, you'll then receive an email to tell you where your regional hub lead is, and they will be in touch with you. That's usually how it works. I don't know if anybody else wants to say something about joining. What happens when you join? Holly Shaw, I collaborate with students and healthcare nurses in Kenya. Be in touch. Fantastic, Holly, please do. Okay, Taha, thank you. We will look out for you. Martine will, who's behind the scenes there, hiding, the wonderful Martine will be looking out for your registration. And we really would like some more students actually, because we want to really engage with them and get them part of the network very early on in their nursing journey and career, not when they've already registered, which I always feel is, 3 or 4 years where we could have been nurturing you even then and giving you these opportunities. And in fact, our regional hub lead, one of them for Wipro or Sea region, I don't get Australia mixed up, but Darcy, she's just finishing. She's getting to her final year. But we've seen students through undergrad. Sana was a student for midwifery, but she was already a registered nurse. But we've seen them do their undergrads, their masters, and PhDs, and and onwards. So let's have a look. Please highlight on the linkage of the country nursing their chapters in the NNC. For example, Uganda has a chapter. Okay, so actually, if you go into our website, there's a map that you can look at and you can see where all the organizations are and the different membership are. So you can do that. If you're not sure, please just reach out to us on the generic email here at the end. Benjamin, are there regional meetings or sessions for members to network and connect? Benjamin, we're just starting to do a bit more of that, but the regional meetings, so for example, the regional hubs run throughout the year, will run their own sessions for that region. And I think this coming year, they're going to try and do some more together. So there are, if you're a member individually, you will receive information directly and also look on social media. But there are regional meetings. Again, if you're not getting that information, please get back to us and we'll just check that we've got the right contact details for you. We've got 3 minutes left. We have a Watson Caring Science group for students, faculty at Meru University, Peru and Kenya. Yeah, Holly, please get in touch with us. That would be wonderful. The map link is on the homepage there. It's just quite new. We've just launched that. So thank you so much, everyone. We have got a couple of minutes left. So I just would like to say thank you. Please join us on social media. Follow us. We have quite a lot of engagement going on there as well. Oh, lovely. I'm from India, Lingon, working in Qatar last 13 years. I completed my hat training course. Thank you. Excellent. We are so glad about that, Zoe. To thank you since the campaign, because I stayed attentive, I've had the honour to take, yes, hat training, health action training. It is absolutely fantastic. I mean, it is transformational. Lincoln is a big advocate of that. I'm working with them for 2 years now. I'm super enthusiastic about translating the introductory course into Spanish. And also when we do our other webinars, we are able to have them translated now. We have a translation option now for people joining us. So please look out for that. Previously it was just in English, but we are now, I think we've got capacity of over 50 or 100 languages that we can translate to. So that means we're much more open to certain areas in the world that we weren't before. Have a wonderful day. If there's some of it left, everyone, thank you to our speakers, our guests, and we will look forward to seeing you at the next WebClub webinar or the book club or anything else that is going on. The grassroots series coming in, I think about November time. Lots going on. Join us and then you will get to know exactly what's happening in your area. Thank you so much, everyone. It's lovely to see you all, and I think I'll see some of you tomorrow. Okay, take care, and Anna, I will see you in a couple of hours. Thank you, Hannah and Martine, for sorting everything out. And I actually, a little hello out to Sahar Kansari, who was a former PhD student of mine. Sahar, thank you for joining. Great to see you join us here today a few years ago there. Sahar, big cardiology researcher, nurse there. Lovely. Thank you, everyone. Take care. Bye-bye.